Excited that you join us today for this very important briefing on a major public health matter of concern. At this time, we will have our first presentation by our head of emergency and communicable disease and emergency response here at CARFA, Ms. Angela Hines, who will give us an update on the situation of monkeypox within the Caribbean. Over to you, Ms. Hines.
Good afternoon, everyone. Good afternoon, Dr. St. John. Thank you, Tamu. And good afternoon to members of the media and to my CARFA staff colleagues. I will, as soon as I can get to be able to share my screen. Great. So, ladies and gentlemen, I'm going to give a brief update on the monkeypox outbreak in terms of its very current to us, very of concern to many. And this afternoon, I want to just give a short overview of what's happening and where we are at now. Current situation, and this is with data as at July 27th. In terms of those countries that are what we consider non-endemic countries, and that is countries who have not had monkeypox endemic to their region or to their state, we have confirmed 18,861 cases. And this is across 70 countries across the globe. As this map shows us, the larger circles are with the larger concentration of cases and the larger numbers of cases. Globally, and that includes non-endemic countries, we have had 5 deaths, and those deaths are in the African continent. In terms of the current situation within our region, the Caribbean countries, we have confirmed to date 9 cases. And as we see here, Bahamas, Barbados, Bermuda, Dominican Republic, Jamaica, and Martinique. Most of these cases have been persons who have had a history of travel. And of course, to date, there have been no deaths. When we look at the 7-day rolling average, we are seeing that it's at first there was a slow rise, but as we see now, it took a sharp uptake, and when we look at it, it's continuing to rise. Even though you may see these little dips in the graph, it's usually related to reporting, but once the reporting picks back up, you see that there's a consistent rise, and this, of course, is concern to all of us. We don't have the global distribution as yet of an epi of the cases in the globe. But what I did here is look at a snapshot of the European region in which they have been able to identify and give a more specific breakdown, and it'll give us an idea of what the profile of the disease is like, especially since the European region has had a larger percentage of the cases to date, and it would be will give us a good gauge of how the cases are distributed. So, for example, if you look at the age and gender distribution in the European region, and this information is from their TESI, which is their European information database on cases, we're seeing that in the 31 to 40 years age group, we're seeing a lot, it's the lion's share of the cases. However, most of the cases are between that 18 and 50 year age group. If you notice, very few under the age of 17. So it's largely an adult disease, transmitting within the adult population, I should say. When we look at the symptomology and you look at the symptoms that are most frequently seen, and this list is only showing those symptoms where you have more than 10% of the patients have identified the symptom. We're looking at the main symptom being any type of rash. And we see here it's about 94%, which of course is typical of what we have been seeing in the pictures of monkeypox, as well as systemic symptoms, and that's things like diarrhea and fever, muscle ache, fatigue, etc. Skin and mucosal lesions, which is again one of what we've been seeing a lot in the pictures as it pertains to monkeypox. The anogenital dermatological lesions, and that's the lesions within the anus and genital tract. And then, of course, rash of unknown location, but this is where persons did not specifically identify. And then, of course, swollen lymph nodes, which is another presentation. And of course, lesions within the mouth. So, as we would have heard, on the 23rd of July, the WHO declared monkeypox a public health emergency of international concern. Why? Why did they do this? Main reason was that it was considered a serious, sudden, unusual, and unexpected event, because we're seeing that this is not a disease that is endemic to many of the countries in which it is spreading. And this was, of course, concern. It constituted a public health risk to other countries through the international spread of the disease. So we see that it's risk to others. Also, it requires a coordinated international response, and which will facilitate the rapid mobilization of resources, streamlining of funds, as well as the acceleration of the advancement of the development of vaccines and other treatment regime that are needed, especially under the emergency use authorization that we are well aware of that occurred during the COVID-19 pandemic. In terms of the transmission, we see that the main transmission is prolonged physical contact with someone who has symptoms. And the symptoms, as I described, as more specifically the rashes, the body fluids, and coming in contact with any of these fluids that would have come from the lesions on the skin, and especially to them, the scabs will facilitate the transmission of the disease. And more specifically, the routes of transmission are the face, skin-to-skin contact, mouth or mouth-to-skin contact. There have been a couple of cases of mother-to-child transmission during pregnancy and via close contact during and after birth. Also to contact with objects, especially within households that are looking after infectious patients and infectious persons. There's a possibility of becoming infected through contacting of objects that the patient may have touched, bedding, clothing, tables, etc. Then comes the most talked about topics, and that's the vaccination. Now, as we have already heard, there is the smallpox vaccine can protect people from getting monkeypox. And we do have data to show that from Africa, it suggests that smallpox vaccine is at least 85% effective in preventing monkeypox. It's also believed that vaccination after a monkeypox exposure may help prevent the disease or even make it less severe. In addition, at this point in time, mass vaccination is not required, nor is it recommended. The WHO recommends, however, that only close contacts of a confirmed monkeypox case should be offered vaccination, especially in light of the limited availability of the vaccine doses and also the price that the vaccines attract. We at CARFA have the capacity to test and do the confirmatory testing for monkeypox. Our current quota is 100 tests for our CARFA member states per week. We do the PCR test method, and our turnaround time is between 48 and 72 hours. The sample required is a swab of the fluid from the lesions, and should another type of sample become necessary, you need to contact CARFA about it. Of course, that brings us to some of the challenges that are experienced during this outbreak. And of course, a major concern is that of stigmatization and discrimination. You know, there have been a fair number of cases that are within the men who have sex with men population. However, stigmatization and discrimination with this community or persons who have had or who have the lesions or rash can potentially be a deterrent to persons coming forward to access services. There's also the issue where, because of the mild nature of the disease, that it can be misdiagnosed or go undetected. Testing also is only now currently available on lesions. In other words, if somebody has been exposed, unless they have the lesions, there's no way to do an early confirmatory test of whether that person is positive or not. The long isolation period has implications for job security, compliance. We're coming out of a COVID scenario where people have been indoors for a while and they're not likely, the compliance of remaining indoors is of concern. There's also the difficulty with contact tracing, given that there are multiple persons, multiple contacts, and sometimes those contacts are anonymous. In terms of, there's a potential drain on already stretched and fatigued health services coming out of, I say coming out of the pandemic, but we know that the pandemic still continues and our health services are quite stretched. With respect to procuring of the vaccines, there are cost implications because the vaccines are not cheap, as well as the limited supplies worldwide. And then, of course, the risk of movement into the risk of movement of the virus into the animal population of the non-endemic countries, where it was, of course, previously absent, is of concern because it could lead to becoming endemic. So on that, I'd like to conclude and say the WHO risk assessment considers the risk to be moderate at the global level. And I say that again, moderate. And in all 6 WHO regions, it's considered to be moderate, except for the European region, where it is considered to be high, where there is a large proportion of the cases currently exist. Communities are to be on alert. We want persons to be alert and aware of the virus and its possible circulation, not to be in fear. Most importantly, we want persons to learn more about how the monkeypox is affecting your community and how you can contract it, and therefore make informed decisions. We want and we ask that we guard against stigmatization. Transmission is not exclusive to the men who have sex with men community. Stigmatization could disrupt efforts in mitigating the spread of monkeypox. Targeted messaging is required, especially during mass gathering events, which could result in cases. And of course, we are asking everyone to remain vigilant. Conduct self-examination and, seek medical attention if symptoms appear, especially if you are aware of a known exposure to the virus. I want to thank you. I have links on the presentation which give and point to more detailed information should anybody require any more pertinent information. And thank you.
Thank you, Ms. Hines, for an excellent update. And we'll now move on to our next presenter. But before I do, I'd just like to remind participants that if you have any questions, you can leave them in the Q&A chat section. I'll encourage you to share your questions. So our next presenter is very familiar to many of us, and that is Dr. Joy St. John, the Executive Director for CARFO, and she will be sharing with us the regional situation and overview. Over to you, Dr. St. John.
Thank you, Madam Master of Ceremonies. Okay, I'm going to be really quick because I know we need to get to questions, but I want to set the stage of what's going on in the region. It's not just all monkeypox. We still have COVID-19 disease. And this is the global picture broken down then into wider Caribbean, including Spanish-speaking Caribbean. So of the 575 million confirmed cases, 4 million have been identified in the wider Caribbean, but in the CARFA member states, our 26 member states, we have not hit 1 million cases reported as yet. And even a smaller percentage of deaths. That is a function of controlled transmission of disease. And it is also a function of the fact that a lot of people nowadays are not bothering to test. However, the big picture is that in the Caribbean, the CARFA member states, is a fraction of what's happening overall. This is a 7-day moving average for all of our member states. Look at the dates and you will see a massive spike that occurred at the beginning of the year. That was when the original Omicron hit all regions of the world at the same time. Everybody had a spike looking like this. And if you look to the extreme right, you're seeing what's going on now. I believe some of this is not quite what's going on. I believe our spike is a little higher, but it will let you know that we are having increased transmission of cases at the moment, fueled mainly by BA5, a little bit of 4, but not too much. And we've also seen the introduction of BE and BF1, which are also subvariants of Omicron, and we behave like BA5, spread really fast, cause very little severe disease. This is a cumulative graph of all of the COVID variants at CARFA. And originally we were working with University of the West Indies, St. Augustine campus, but now we are doing our own testing. And there, you will see that there has been a really quick overtaking of Omicron. Omicron is the 1, 2, 3, 4, 1, 2, 3, 4, 5, 6 bar. And Omicron has really taken over in terms of the numbers sequenced. Omicron has been found in 1,071 samples. That includes the original Omicron, but more so BA5 at the moment. But you can see that practically every variant came to the CARFA member states at some point. And the ways in which the Caribbean has kept those numbers small have been largely on prevention and also vaccination. But there's been a lot of vaccine hesitancy. And on Wednesday last week, we launched a partnership between USAID, UNICEF, and CARFA to implement a campaign to improve vaccination coverage. This is a media communications campaign. So we are still working on this whole issue of vaccination, not only because it has affected vaccine uptake for COVID-19 vaccines, but we've also had some serious issues with waning vaccination coverage of our routine vaccines, polio, measles, MMR, even tetanus for adults. So in order to try to improve the understanding of what member states need for regional health security. So it's COVID and monkeypox we're looking at now, but something else will come around in the near future. So CARFA held a regional health security conference last week in Trinidad, where we brought our member states, chief medical officers, lab directors, epidemiologists, and environmental health officers together. And this is a picture of the first day with the chief medical officers and the Minister of Health of Trinidad and Tobago and some of our partners. I forgot to say, we didn't do it on our own. We also had several public health agencies, those with interest in the Caribbean region. So apart from PAHO, CDC, Public Health Agency of Canada, UK Health Security Agency, we also had the Dutch Public Health Agency, and we had our donors. So it was like a one-stop shop for the member states to say, this is what we need, for the public health agencies and the donors to get an idea, because we want to really upskill the region and ensure that whatever comes, the Caribbean is ready. So we had our news about monkeypox, and the thing that is really important for me about monkeypox, I think it is a tale of preventing the establishment of monkeypox in the Caribbean. Now, we've had several communicable diseases pass through. There's some that are now endemic in the Caribbean, dengue fever, for example, but we really don't want the establishment of monkeypox. So it's going to be really important for you to do a job of letting people understand how they can protect themselves, and also not creating an environment that makes people hide, because when they hide, this is when we can get disease spread and establishment. Talking about what's the next thing around the corner, I know we have a pandemic. I know monkeypox is being declared a public health emergency of international concern, but polio scares me. Why? Remember, I told you that the regular vaccination coverage has dropped off. Polio, unfortunately, has not had the coverage it needs. And the thing about polio is, once you have a severe infection and you become paralyzed, that's it. You can't treat, you can't reverse. And you may not be paralyzed, but you more than likely, someone else will get it from you. So polio scares me quite a bit. This whole issue about how it used to be in the bad old days, common cause of paralysis in children. We don't want to see that happen here. So the global vaccination campaigns work, and anything that's against vaccination generally will stop all vaccination. So your role, and one of the reasons why we're doing the media briefing, is to ensure that we stop this misinformation and disinformation. It spreads faster than facts. The social media, it's quite the thing to be transmitting messages without even checking first. And you have a role in telling people, no, that's not it, by making sure the source of information, including you, is a credible one. And CARFA will continue to coordinate. We have to coordinate our efforts to assist member states in reducing the importation of new communicable diseases. We need to continue to coordinate the health emergency and response plan. And we're really pleased that you're here with us to allow us to have a good conversation with you, get to understand what you need to know and what isn't clear to you. And so, Madam Master of Ceremonies, let's get to the questions and answers.
Thank you, Dr. St. John, for a comprehensive overview on the situation, again, with respect to COVID, situation with respect to monkeypox and or communicable diseases. At this time, I'd like to welcome anyone who has just joined us, who joined us when we started. I am Dr. Tammy Davidson, the Assistant Director for Surveillance, Disease Prevention and Control here at CARFA, and the host for today. At this time, we'll invite you to provide any questions here that you may have, to place them in the Q&A at this time. I see one question about the presentations being shared.
Yes, we can do that.
Okay, yes. Any further questions?
We have 51 people in the room.
Yes.
Nobody wants to ask a question. That's very strange.
Yes. I would see we're in the Caribbean. One of the things that we certainly do is certainly have a lot of questions around this. I see a question here from Shamar. How many samples has CARFA tested since the organization began testing for monkeypox? And also, when exactly did CARFA begin testing for monkeypox? It's for our panelists. Yeah.
Yes, they can also ask questions on mic.
On the mic, yes, you can on the mic and chat. But who will take this question, Ms. Hines?
Yes, we have received, let me just get my camera on. Yes, we have received about 13 samples to date from 5 CMS. With respect exactly when we start, I can't tell you the exact date. I would say it was in early June, Dr.
I'm checking to see.
Yeah.
I'm checking to see when we did. It was when we were in St. Lucia.
I think, yeah, I have here possibly around June 23rd.
Okay,
Yeah.
great.
Thank you. An agreement with the CDC. Yeah.
Yes.
Okay, we're now getting several questions. We have one from Sunil. Is CARFA currently in discussions to procure vaccines for monkeypox on behalf of the Caribbean?
Now, where did that question
come from? This is
Mrs. Hines, where did that question come from?
This is from TT News. TT News, Trinidad and Tobago. Yes.
This is a really quick one. So Mrs. Hines would have outlined to you the serious issues with availability of vaccine anywhere in the world, especially in the Caribbean. There is a core coordinating group chaired by SEDIMA, which meets now once a month. It was convened initially to deal with COVID-19, but this group, which comprises CARFA, SEDIMA, CARICOM Secretariat, Pan American Health Organization, an organization of Eastern Caribbean states, has started having more of a health security perspective. And we met yesterday, and we were discussing this issue of how expensive the vaccines are. How in the Caribbean, the way we see things developing, we do not expect any real, how to put it, establishment of monkeypox, either in one country or more than one country. Yes, we expect importations, but the health services are so on the alert. It is going to be unlikely, unless people are hiding, it's going to be unlikely that we will not capture cases and contain the epidemic. So we were discussing how it would be nice if we could find some way to have access to some sort of procured standby, but this is just a discussion. Obviously, we would need to approach the member states about it because it is not cheap, not at all. We had heard some prices about what could possibly be the number of doses put aside, and it was quite disturbing, the amount of money that it was. So it's something that we actually therefore have put to CARICOM, because the CARICOM Secretariat would need to get the regional perspective on that possibility. Over.
Okay, thank you, Dr. St. John. And we do have another question here. If someone is vaccinated, can they still get monkeypox?
So Angela, you start off with that one.
Yes, they can. It's if 85, research has been shown in the past that it's 85% effective. Therefore, there's a 15% likelihood that you can still get monkeypox. However, studies have also shown that the severity is not it's not as high. So you're likely to have milder symptoms having had the vaccine.
Which is not unlike the current COVID-19 paradigm. It may not stop transmission, but it will definitely stop from some of these really awful stories that we've heard of monkeypox more or less taking over the body. However, what the WHO is recommending is that close contacts. And so there is post-exposure vaccination that we are looking at here. Pre-exposure vaccination is not anything that A, we can get our hands on all of those vaccines, and B, we can't afford it. So we would be looking at post-exposure vaccination. Next question.
Okay, so can you, again from Sunil, can you give an estimate as to how much does one vaccine cost?
Ms. Hines, I had heard something around $100 US a dose. And if you have not had smallpox vaccination, which would be the older members of the community like me, if you have not had smallpox vaccination, you get 2 doses. If you've had smallpox vaccination, you get 1. So for most people, especially in the age group where it has been prevalent in this global outbreak, you will need 2 doses of the vaccine.
Okay, our next question. It seems like future vaccination uptake will be a serious problem. Are there any campaign plans to address this across the region?
So CARFA doesn't have a vaccination program, but we have the communications program. And the communications department of CARFA has been working very hard with the member states. We have 2 layers of interface. And I don't know if Ms. Curtin wants to talk here. I hope she does. We have 2 layers of interface. One is with our focal points in each of the member states, the Regional Health Communicators Network. And then we also formed a special expert working group drawn from the member states again, people who have had success in their national setting in getting past vaccine hesitancy. But there are also immunization campaigns. And in this regard, Pan American Health Organization would be working with the expanded program on immunization managers to have that type of vaccination drive as necessary. Every year around April, there is Vaccine Week of the Americas. And in that time, the immunization managers focus on a particular, either something like what they did this year, they focus on COVID-19, or they can focus on a catch-up campaign depending on the age group. So there are many modalities that have been going on all the time quietly with vaccination that people may not have noticed before, because vaccination wasn't sexy before. But there are several layers of vaccine. Ms. Curtin, have you decided to say anything?
Dr. St. John, I can just add to what you have already stated. in that, just to let the audience know that we do have an upcoming annual meeting of the Regional Health Communication Network that will commence, that will be in September. And that meeting in September is where the communicators from all of our 26 member states will come together, and we will be looking at our risk communication strategies, not only where COVID-19 is concerned, but monkeypox. And there we will get feedback from all of our health promotion specialists and communication specialists who will in fact advise us on what is happening on the ground in their own countries, what are some of the challenges that they face and what their needs are. And so we will be having very comprehensive discussions on this, and we will be able to plan strategically on how we will be able to meet the needs of our member states through communication strategies for monkeypox and also other outbreaks that we may anticipate in the future.
Okay, our next question is, are there any long-term effects of monkeypox? Over to you, Mrs. Hines or Dr. St. John.
You're muted.
Yeah,
Unmute.
yes, I've just read on full recovery, but I'm not too sure. I'll pass over to Dr. St. John. Have you heard otherwise?
No, usually what happens is that, especially this strain or type, it has a very low death rate, and usually it's milder symptoms. With this global outbreak, we're seeing some different presentations, probably because of the way in which it's being passed. So I would like to reserve comment on if there will be lasting issues from this particular global outbreak, because really the presentation is quite different. But usually in the endemic countries, mainly in Africa, you would contract the disease and it would be a mild case and you would move on with your life. So hopefully this is what will happen, even though the presentation is so much more severe in this particular outbreak.
Okay, we see if we have any more questions here. Seems like we have no more questions for our panel.
This is lovely.
Yeah, I'm looking. Oh, I did. Okay, we found a new question here. We do have, will CARFA be developing an infographic to share with member states on symptoms, incubation, treatment, etc. around monkeypox?
Well, CARFA has been waging a social media campaign about monkeypox and everything monkeypox, which did have some communications, but if you want an infographic, Miss Curtin, save me here. Miss Curtin, are we going to be doing a special infographic now that the press have asked us for this? Because I think that if they ask us, it would be a good idea.
That is certainly something that we would do, and I think it would be tabled at our incident management team for emergency response, which we have regular meetings and discuss situations or incidents like these that would help our member states to be better prepared to address outbreaks like COVID-19 and also monkeypox. So this is something that I will take to the IMT-ER meeting, which we will have on Monday. And definitely this is something that we will look to develop in the very, very near future to share with our member states.
So thank you for that suggestion. Who was it, Tamu?
Who asked the question?
Yes.
Elena Hill. I think that's from the Oasis.
Thank you very much,
Yes.
Elaine. We will do that.
We also have another question here. As a parent, and we're having some more questions. As a parent, how do I protect my teenage children and my community?
From monkeypox?
Yes.
Okay, so the first thing is to remember the way in which it's transmitted. It's not transmitted like COVID-19. It's not airborne. It demands close contact, prolonged contact, and exchange of body fluids. And so the kind of activity of a child and the activity of a teenager can be monitored, and you can advise them about this. We really are expecting that the way in which this outbreak has exhibited itself around the world, but mainly in Europe, will continue. That is, it is not going to be easily spread unless there is activity which promotes it. So if as a parent, you have concerns about the activity of your child, it's going to be really important to work with your local health authority and translate the information, if it isn't already translated, into information that makes it clear to the child or the adolescent. This is what it's safe to do. This is what it's safe not to do. I noticed that children and teenagers have paid a lot of attention to the standard infection prevention and control messages that were common during the earlier parts of the COVID-19 pandemic. So you can build on that. But close contact is close contact. So as a parent, you will be able to say, not this, don't do this, but it would be okay to talk with your friends.
Okay, thank you. There's another question here from Suzanne Shepherd. Hi, can you speak to the issue of discrimination against the vulnerable community?
You want me to start, or you want to start, Angela?
I can start.
Yes.
Of course, with respect to any intervention or when you working towards stopping the spread of a disease, you need to look at where its transmission is, who are the vulnerable populations, what are the risks, etc. But also part of it is the messaging. It's the we have learned so much from COVID-19 in terms of working with the vulnerable communities in terms of communication, messaging, but more specifically, advice with WHO is to also partner with the vulnerable communities that have been identified, and partner with the leaders in those communities, and working with them with respect to the messaging, with respect to the sharing of information, so that everybody is well informed with respect to any events those communities may be having, and capitalizing on getting the message out in terms of everything that surrounds the transmission, the determination or the self-examination, etc., that needs to take place, where the health services are, how to access them, as well as support groups with respect to, should there be persons who do become infected, how do their household members support with and do the necessary, say, IPC prevention control measures to ensure that they too do not become infected. So I mean, it's a lot that's happening in the background. A lot of work is going around internationally in terms of WHO has been leading in terms of coordinating some of these drives with respect to the information, the approach, and so really, of course, we've seen discrimination. We've dealt with discrimination in various disease scenarios. More specifically, we know of HIV, for example. So we do have experience in dealing with discrimination with these. And we've learned a lot over the years, and we've gotten much better at it. And some of these lessons that we're going to learn in terms of making it or ensuring that we don't have discrimination. But, you know, part of discrimination also too is information and understanding exactly the reasons, how things are transmitted, why, how to avoid it, how to make informed decisions in terms of what we do to reduce the risk of being infected. So yeah, I'll hand over to you. Oh, I think you're muted, Dr. St. John.
I want to step in here and throw the question back at the journalists, because the tone that is set by journalists also is very important. That's why we're approaching you so fast after this. And we did try to get PAHO to join us, but we had given them too short notice, but we only decided to do this 2 days ago. This is why we're reaching out to you. If there is a tone of science, facts, understanding of the community rather than pillorying the community, we can get away from the discrimination. In the Caribbean, we saw a lot of people being discriminated against initially for COVID-19. And then we got to a state where, oh, you had COVID-19, I had it too. We need to have that understanding in the way that we approach this monkeypox outbreak as well. Not everyone who gets monkeypox is from a community. Sometimes it is children because of the circumstances in their particular neighborhood or village. But we don't need to have a negative outlook on this. We need to treat this as a communicable disease that has to be dealt with.
Okay, we have another question here. Following the high levels of vaccine hesitancy among adults, are you concerned that parents will not allow their children to be vaccinated? Reports across the region highlight there is some level of hesitancy to get children vaccinated against COVID and other diseases.
Yes, yes, yes. Vaccine hesitancy has seen parents say they're not allowing their children to be vaccinated against COVID. It has seen children, adult children, refusing to take their elderly relatives who are very vulnerable to get COVID-19 vaccination. And unfortunately, our vaccine coverage for the routine diseases like polio has fallen as well across the region. And so vaccine hesitancy has done what I really hoped it wouldn't do, which is to start a trend of refusing to take vaccines generally. It is very concerning. And this is why I said that of all the things going on right now, I'm scared most about that case that has been discovered in the US, because it wouldn't take much. People say, what it is, they say, no, if the US sneezes, the Caribbean gets a cold. It wouldn't take much for someone to travel, interact with the community, interact with their family, with a child. That child picks up polio because they have not been vaccinated and that child is paralyzed, or that parent. So yes, vaccine hesitancy is doing the worst.
Okay, we have another question here. Would you encourage general general messaging or targeted. The trans MSM group, for example, has since shown resistance to our closed group discussions because there's a feeling of stigma and discrimination.
So it has started already. This is unfortunate. Perhaps there was the sense of stigmatization and discrimination that this monkeypox issue has just landed on. I can tell you what has happened in the UK, and perhaps Angela, you can support where this is concerned. They have been very specific and very clever about their messaging and about how they are making sure that the community is fully aware of the information and fully aware of the vaccine that they are distributing. The UK really has done a very good job of also understanding behavior patterns so they know where to find people or where people might go and to warn them in these different venues. So yes, it's going to have to be a general and targeted in the way that we have with COVID-19 done general messaging and targeted messaging. We're really ramping up that whole issue of targeted messaging in the communications department for COVID-19. And so the skills and the frameworks can be adjusted slightly as necessary for monkeypox.
Okay, thank you. And we do have another question.
Oh dear.
This one is, how rapid do you expect monkeypox to spread in the Caribbean?
Not very. I watched the Caribbean people during the COVID-19 pandemic, especially early stages. The Caribbean people did their review of what was happening in the world around them before it got to the Caribbean. And then they did what Caribbean people do. What is going to be the best way for me to deal with this? And I suspect that this will be what is happening in the Caribbean. The Caribbean has paid good attention to the monkeypox and how monkeypox outbreak has evolved. And I think our people, unless they're in the height of a particular festival season, and they're not thinking clearly anyhow, I think our people are going to be pragmatic and careful. So I hope that I am not disappointed by the Caribbean people. I don't think it's going to spread very far or very fast.
Okay, well, I don't see any more questions for you, panelists, and Dr. St. John and Ms. Hines. I think we've had quite a rich discussion here.
I'm very happy. I'm very happy with the questions. Thank you very much to the media.
Yes, so we'd like to thank everyone for joining us, including the media. We know you will assist CARIFA in continuing to spread the facts and avoid misinformation. And so we're really delighted you could be here today and join us. And I'd like to give a special thanks to our panelists, Dr. Joy St. John and Mrs. Angela Hines, for the overview and really answering these questions, which have been fantastic. You have been wonderful, and we look forward to our next media briefing with you. So walk good and take care of yourself in Caribbean style. Thank you.
Thank you very much for masterfully being the master of ceremonies, Dr. Davidson.
Thank you.
Ooh, I like the reactions. Very nice. Thank you very much, media. We tried our best.